Mandera County Referral Hospital, the only referral facility in the county, serves a population of 1.5 million in Mandera and environs. Years of marginalization reduced the hospital to total ruin and neglect. In spite of this, the hospital has continued to serve the people of Mandera in a state nowhere close to a referral facility. This is one of the main reasons why Mandera County is leading in maternal mortality rate in the world, standing at 3,800 deaths per 100,000 live births. The hospital lacked facilities as basic as decent washroom. Medical supplies were carelessly stored with no clear distinction between the expiries and fresh supplies.
Hapa Mandera County tuko na shida ya madawa. Hatupati madawa ile inatakikana. Tunamwambiwa tutafute kwa chemist tuko.
Sasa hospitali ya Mandera hatupati dawa ya kutosha. In fact, yani tukiandikiwa dawa antibiotics ile strong ambayo imeletwa na serikali juzi na gari imetermishwa hapa, and the following day tunaambiwa dawa hakuna, yani go to the pharmacy.
Irren qabdu dhaqtay wa bitateen dandeetu waqtigi jufa fulan juftila beesetate marka shidante masuli dawa ya kutosha serikali inuu ndufun fen.
The laboratory lacked basic equipment for conducting simple tests.
Since this is a referral hospital for the county, we need any CD4 machine for HIV patients who are on treatment to monitor the progress of their treatment.
The X-ray section, long forgotten.
In Kenya today, I think it's only Mandera District Hospital that is using what we call manual processing, TCR. It's an old-fashioned method.
The hospital laundry not in place. The TB isolation cubes and the mortuary were left unkempt and vandalized. Patients admitted to the facility had to bring with them bedding and food. The wards left filthy and messy. Condition of the hospital kitchen deplorable.
We are committed to changing the situation at the County Referral Hospital and also the other sub-county hospitals and the health centers.
Lack of proper medical facilities, acute shortage of skilled staff and crumbling infrastructure are top on the administration's priority list.
The healthcare sector we inherited was total of 52 health facilities, and out of which only about 10% of the health facilities were operational at less than about 10% capacity.
Upon assuming office in 2013, the new county administration hit the ground running. The referral hospital is gradually shedding out of the old image of despair and dissolution. A rigorous drive to revamp the health sector has been initiated. The campaign would realize a modern referral hospital well equipped with the capacity to handle most medical needs of the people. The wards has since been transformed from this to this. To address the issue of staffing, the county government has recruited more than 265 skilled medical personnel in addition to the pre-existing ones. As opposed to the previous manual record keeping where medical records were filed and left to gather dust in the shelves, Mandera Referral Hospital is upgrading to complete automation with digital record keeping system. This will solve the rampant issues of lost records through poor filing system and record keeping, as well as make the records easily accessible when needed.
This heavy investment in infrastructure shall be followed by automation. At the County Referral Hospital, we shall go paperless in 2014-2015, completely automating our system from patient consultation to the pharmacy prescription to the laboratory staff records, and generally the patient records shall be automated. The facility shall have 24-hour CCTV coverage, which shall improve security and that shall also improve service delivery, as we shall be able to observe the flow of patients and see where bottlenecks are and invest in improving the bottlenecks that delays service delivery.
Years of underfunding of emergency ambulance services saw gradual collapse of the service. Medical evacuations have now been eased with the commissioning of 7 equipped with an ICU medevac. This number expected to rise in the near future. The ambulances have since greatly improved medical outreach services and saved hundreds of lives. Medical outreach services are being conducted targeting the nomadic communities and the elderly who may have difficulties getting to the health centers.
70% of our population are nomads, and for this pastoral community to reach health facility or settlements where there is health facility is difficult. To cover that, so that every mother, every child, every person in this county will access health services, we embarked on outreaches. Each facility has an outreach, whereby there is immunization, there is treatment of minor ailments. There will be referral from these outreach sites.
Currently, thanks to the county government, we now have ambulances that go to all the corners of this county. And when we receive a call from any of the sub-county or even the health centers, the sub-county hospitals, we are able to send the ambulance there. They take the patient. The ambulance has a paramedic and it's a fully equipped ambulance. We have at least 10 deliveries, 24 hours. Sometimes they can be more, sometimes they can be less. This is generally an average.
Similar upgrades are underway in all other district hospitals and health centers across the county in an ambitious campaign to overhaul the health sector in Mandera.
We increased the health personnel by about 200%. Phase 2 was to make sure now that we had personnel is to get Medicare supplies, in terms of drugs, pharmaceutical and non-pharmaceutical items to these health facilities, which we did and distributed. And within pretty much a period of less than 4 months, we were able to operationalize 100% of all the health facilities that were available. Not only that, but managed to also add an additional 8 health facilities, bringing the total number of health facilities that were operational to 60 health facilities.
With the upgrades, maternal mortality is expected to reduce considerably within the year 2014-2015. Similarly, the intervention will realize an improved access to medical facilities through construction of new health centers in far-flanked areas within the county.
This is a facility that we used to refer even for minor operations. Now we're able to have even bigger operations. We have the diagnostic center, we have the blood bank. So most of the service in the next 5 years, this facility can be a referral. And the best thing Kenyans have done was to go to devolve services, especially health services.
Currently, we are not able to engage in major surgeries like explorative laparotomies, simply because we are still awaiting the general anesthesia equipment. The county has already procured those items, but they are yet to reach us. So for now, we are only able to do those surgeries that requires local or regional anesthesia, like the cesarean sections and other minor surgeries.
In the 21st century, health is a shared responsibility involving equitable access to essential care and collective defense against disease. This is a resolve made by Mandera County in an understanding that healthy citizens are the greatest assets to an ambitious nation.
We are now in the process of upgrading the health facilities. The county hospital, which is Mandera District Hospital, we're in the process of upgrading it to level 5 hospital with all level 5 health facility equipment. And we've also started the program of upgrading the level 3 hospitals at the sub-counties to level 4. This is Elwak, Banisa, Takaba, Lafe, and Ramo. And this program is also well underway in terms of facility improvement. And phase 3 now is to make sure that at each of the ward headquarters, we have a maternity ward and a delivery room fully equipped with the right personnel and equipment that are required.
Turn around our health sector.